Alright, good day, guys. Welcome back to my channel. This is Dr. Paramount, a go-to destination for orthopedic insights and practical knowledge skills. Last week, I discussed about the management of metacarpal fractures. When metacarpals are fractured in the body, both on the right hand and on the left hand, what are the management options that you're going to get as an orthopedic technician and as an orthopedic technologist? So, what are the conservative management in managing metacarpal fractures? So I did justice to metacarpals 4 and metacarpals 5 in my previous lecture. So if you need more knowledge about that, get through that lecture and you will get more understanding to that. So I told you last week, that when there's a fracture to the 4th and the 5th metacarpals, that is the 4th and 5th metacarpals, that is when we do ulnar gutter split. So there has to be management that we're going to do for the remaining metacarpals in the body. So I told you we have 5 metacarpals here, we have 5 metacarpals here, which makes 10. So we have metacarpals 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5, which makes it 5 metacarpals on this right hand and 5 metacarpals on the left hand. So when metacarpals 4 and 5 is fractured, that is when we do ulnar gutter split. So there has to be managed for other metacarpals we have in the body, such as metacarpals 1, metacarpals 2, and metacarpals 3. So that is what I'm here to do, to take you through the journey process of metacarpals. Alright, so today I'm going to be talking about radial gutter split. Radial gutter split. I told you last week, ulnar gutter split. In subsequent lecture, I'm going to be talking about radial gutter split. So, what are the indications for radial gutter split? When we hear radial gutter split, or as a student, when you hear radial gutter split, or as a technician or technologist trying to apply a splint to patients' wrist, rather, what are the indications? So, when there's a fracture to the 2nd and the 3rd metacarpals, so that is when we do radial gutter split. Last week I explained vividly about the 4th and the 5th. We have the 1, 2, 3, 4, 5. When there is 4th and 5th, that's what I discussed last week. But this week, when there is a 2nd and 3rd fracture of metacarpals, so that is when you do radial gutter split. And I told you where the radial is coming in and where the ulnar is coming in. Why do we have to call it radial gutter? Because when you trace the 2nd and the 3rd metacarpals backward, it's going to fall on the one of the forearm bones. I told you the bones of the forearm are radius and ulnar. So when you trace metacarpal 2, metacarpal 3 backward, it's going to fall on the radius. So that's why we call them radial gutter. For you to understand which side we are actually talking about, when you hear radial gutter, you actually just have to trace the radius bone in a forward momentum, and then when you get to the metacarpals, you're going to accumulate the fat of metacarpals 2 and metacarpals 3. So when you have a fracture to the metacarpals 2 and when you have a fracture to the metacarpals, when this happens, you call for radial gutter splits. So that's why apart from fracture to that place, there's something where if you have soft tissue injuries to the metacarpals 2 and metacarpals 3 as well, you go for radial gutter splits. So apart from the metacarpals, there are other conditions where you can apply radial gutter split as well. When there's a fracture to the intermediate or the proximal phalanges, what am I talking about? What am I talking about when I say intermediate and proximal phalanges? This is phalanges. I told you last week, these are metacarpals and these are phalanges. We have 14 phalanges on one hand, then 14 phalanges on the other hand, then 14 at the lower extremity as well. So when you have an intermediate or proximal, which is closer to the metacarpal phalangeal joint, that is the joint between the metacarpals and the phalanges, is what we call metacarpal phalangeal joint. So when there is a fracture to the phalanges that is closer to the joint, that's what we call the proximal phalanges. So when the fracture is somewhere around this place, we also apply radial gutter split. So not only for the fracture of the metacarpals, which is 2nd and the 3rd metacarpals, when there's a fracture to the proximal phalanges of the 2nd and the 3rd, we also go for radial gutter. So those are the indications as far as radial gutter split is concerned. The first one is when there's a fracture, be it displaced or is not displaced, manipulative reduction will be done, and the conservative pattern of immobilizing that pattern of fracture rather is what we call radial gutter split. Fracture to the 2nd and 3rd metacarpals, that's number 1. Number 2, where there's soft tissue injuries to the 2nd and 3rd metacarpals, and as well as proximal phalangeal fracture of the 2nd and 3rd, or intermediate, which is the center. So when all this happens, you call for radial gutter split. Then how do we apply radial gutter split? Radial gutter split is applied just like ulnar gutter. Now, before you apply, there has to be some measurements That is, the patient, if you have an assistant, fine, you can apply a radial butter splint. And if you don't have an assistant, it is fine. You can actually do that as well. Maybe you find yourself in a geographical area where you can't get an assistant or circumstances warranted that to happen. So there are times you can apply some casts without any assistant, just you as a technician or and your patient. And there are casts also that needs more than one assistant self. So in this case, if you don't have an assistant, your patient can just stay like this, can just stand, provide the table for your patient, and the patient is placing the helping joint on it. Then you begin to apply what you want to apply. Then you make sure you cut the cast, you cut the bandage material, the POP you want to use into two. You measure the volar aspect, then you measure the dosal aspect. This is different from undergut aspect. Undergut aspect, you just measure once and you apply it to the leg, which is going to cover this place and this place. But in the case of radial butter splint, you are going to measure it differently. You measure the volar aspect, which is the palm side, then you measure the dosal aspect. When you measure the dosal aspect, you start from the shaft of the horn radius down to the 2 centimeters below the metacarpophalangeal joint. And most of the times, depends on, let me come here, let me explain something here. Depends on the area of the fracture or the injury. If the fracture happens on the metacarpus, like I've said, and the metacarpus, the location of the metacarpus is not closer to the joint. Let's say, for instance, the fracture happened on metacarpus and it's at the shaft of the metacarpus, it's not closer to this joint. You are going to apply the radial butter splint and it's going to stop. It's not going to immobilize the metacarpophalangeal joint. But if the fracture is closer to this joint, or like I said the other time, that if the fracture is on the phalanges, I told you that if there is a proximal phalanges fracture, you have to apply radial butter splint. In the case of proximal phalangeal fracture, where the fracture happened here or here, when you are applying your radial butter, it's going to extend to the phalanges and it's going to immobilize all the phalanges. So there are times when you see radial butter splint, so that you not be confused that, okay, some radial butter splint are stopping here, while some are stopping here. It depends on the area of the fracture, where the fracture is located. There are fractures that happen at the shaft, at the middle of the metacarpus. In that case, you may not have to extend the cast above this joint, which is the metacarpophalangeal. You may not have to extend the cast above it. The splint may just stop below because it's not closer to the joint. Because you need to follow the principle of mobilization by immobilizing the joint below and the joint above. So in that case, if it's not closer to the metacarpophalangeal joint, stop the splint beneath the metacarpophalangeal. If it is closer, the fracture is closer to the metacarpophalangeal joint, or the fracture in the phalanges as well. So the phalanges are closer to the joint. You have to apply the splint to the shaft of the ulnar radius of the middle and extend it. It mobilize the phalanges. So it mobilize the phalanges of the ulnar aspect, it mobilize the phalanges of the bigger aspect. After that, make sure your metacarpophalangeal joint is stable to 60 degrees. Do it in 60 degrees. After all this one is done, then you apply your crepe bandage. By that time, you must have done something the way I taught you last week, that while immobilizing these two digits, you must make sure you pad them separately because of maceration and ulceration as well. So you pad this place separately, you pad this place separately, then you pad them together. Then after putting the splint, you put this splint on this side separately, you put the other splint on this side separately. Then you apply your crepe bandage to hold it firmly. Then after the completion of the cast, you suspend the hand in 90 degrees to apply on radial butter splint for the fracture, for the management of fracture to the metacarpus, second and third. Last week I talked about third, fourth, and fifth, but today I'm talking about second and third. And this is the last digit on that particular metacarpus is what we call the top. In subsequent lecture, I'll be talking about that management as well. So as for you to get the full knowledge when it has to do with fracture of the wrist, either the carpus, either the metacarpus, or the phalanx. Every one of them has their own management of fractures conservatively now. You apply it with either POP or in form of splint or any materials that is not surgical. So this is the best way to apply to manage fracture of the metacarpus 2 and metacarpus 3, and also for the fracture of the intermediate or proximal phalangeal 2 and phalangeal 3 fracture. Or if you have soft tissue injury around metacarpal 2 and metacarpal 3 fracture. So when all this happens, you call for a radial gutter split. So this is where I'm going to be stopping today. In my next lecture, I'll be talking about some other fractures in the body that can be managed conservatively. Don't go without subscribing to this channel, because it's only on this channel I give you updates concerning the conservative management of fracture to see, and that is what I will continue to say. So for mentorship and guidance, you can actually copy the number you have on your screen. See you guys in the next class.